today's topic with a quote that a healthy woman is a radiant force of a nature. It is unshakable, unbreakable, and unstoppable. If she remember who she was, the game changes there. So let's begin with the topic of today's. And in the introduction, mental health challenges among the women in India are deeply rooted in socio-cultural context. Roles play a vital roles. We have been seeing a lot of biological hormonal stress element in day-to-day life. Today, I'll be talking about some social factors and the mental health factors related to the women and the social determinants. According to WHO, it estimates that approximately 1 in 3 women globally experience mental health issues, depression, anxiety, among the most prevalent conditions. In India, the prevalence of mental health disorder among the women is significant, with estimates that suggest up to 25% of women suffer from depression and anxiety. Statistics also shows that since from 1993, the rate of self-harm, eating disorder, post-traumatic stress disorder, and anxiety is being increasing, and very less amount of research has been conducting to pop out those issues socially. Now, let's start with the first subtopic, that is depression. Depression is a significant public health concern globally, and the women disproportionately affects affected as compared to men. In India, studies have been consistently shows the higher rate of depression in women, and the prevalence of depression in women varies across the different studies and estimates from 15 to 50%. And this I have been taken from Journal of Emerging Technologies and Innovative Research. Now, continuing to this, National Mental Health Survey of India reveals that the prevalence of depressive disorder among the women was significantly higher than the men, and targeting the age group that have been observed between 40 to 49 years of age group in women. Now, second is anxiety disorder, which includes a generalized anxiety disorder, panic disorder, phobias that are common in women in India. The two study I have been taken, and according to first study by Patel in in 2003, that Indian women range from 2.5 to 5.8% have suffering from anxiety disorders, but for the various reason, of course. And the Sharma study that also reported the prevalence is 14.6%. Now here I have followed the two trend. One, in 2023, the rate has been increased from 5.8 to 14.6%. Now you can assume that the kind of anxiety disorder is increased among the females because of the various factors such as social role expectations, so societal pressure, and the stigma, lots of stigma, mental health issue. Now, the previous, if we talk about, women were considered more over for the reproductive roles, and the main is, and in as compared to men's, they are considered for the production. But today's world, women are considered not only for the reproductive roles but also for the productive role and parental role as well. So the kind of responsibility she is having and she is suffering, it has been increased, and expectations is also increased. Now, third one is post-traumatic disorder. Is the more common in women. Reason is pretty unknown, but the female specific post traumatic disorder has been limited. Now, the research that asks women about harmful or traumatic childhood experience called adverse childhood experiences shows that twice as likely to men have experienced 6 or more adverse childhood experience between the age of 1 to 17 years. Um, During my working experience with Arogya Seva last 1 year, I have been working with mental health, menstruational health, and so many reproductive health targeting adolescents. And during that time, I have been encountered so many adolescent childrens um, having different experiences from like they are suffering from their childhood regarding their education, their health preferences, family preferences, food preferences, basic taboos and stigma. That's why I put this point here. They suffered a lot, and the children, specifically girls. They are more common in women, sorry, and 10 to 12%, and compare as compared to the 5 to 6% in men. About 1 in 10 women develop post-traumatic disorder in their lifetime. And also, the study indicates that 16 to 42% of Indian women experience domestic violence, suffer from post-traumatic disorder. Socio-cultural factors, now I'm talking about contributing to mental health challenges in women's life. Gender role, patriarchal norms in India, traditional gender role and patriarchal norms have been a significant impact in women's health, mental health specifically, because there are so many times she couldn't even speak and to share what actually she is feeling about their patriarchal um, so many limitations and the challenges that she has been suffering from. She has to sacrifice a lot uh, because because to be in that family, to be in that happy family, women often expected to prioritize domestic responsibilities, caregiving roles, familial obligations over thinking well-being and thinking of their well-beings, and the lead increased stress and breakouts and lack of autonomy, which can contribute to the development of mental health issues. Now, the important point is violence. Domestic and intimate partner violence is something which needs to be mentioned more loudly, is a major public health concern in India with a significant impact on mental health of a woman's life. Studies have been consistently showing a strong association between the experience of domestic violence and increase of depression, anxiety, PTSD, that is post-traumatic disorder, mental health disorder among Indian women. Physical, emotional, and psychological trauma resulting domestic violence can have a long-lasting impact on women's health, mental health, of course, and even after violence has ended. Economic conditions like poverty, socioeconomic status, low socioeconomic status are the significant risk factors for a mental health issue. And women from lower socioeconomic background often face multiple stresses, including financial insecurity, limited access to the health care resources, poor living conditions, poor health conditions, often compromise more uh, for their family, barriers due to stigma and discrimination. Social determination is a considerable topic towards the women mental health, like stigma, mental health issues are pervasive in Indian society. They have been profound impact on women's willingness to seek help and access support services. Cultural attitudes and beliefs are the barriers, of course, and often view mental health problem as a personal weakness or a source of shame, leading to reluctance to acknowledge and address their issues. Yes, offering mental health help is not just enough, because we need to talk about it, and women need to understand that from sharing things becomes easier for her and for the society and for her family also. Availability and accessibility of mental health support services, healthcare infrastructure, resources. Access to mental health services in India is still limited, with a significant shortage of mental health professionals and resources. Often the condition is improving now, but the vulnerable population faces a huge gap. Barriers to assessing mental health. accessing mental health services. Despite of availability mental health services, participants identify numerous of barriers that prevents women from accessing these services. Most commonly cited challenges were financial constraint, lack of awareness, stigma, and the geographical barriers. Of course, a woman living in a vulnerable population, living outside the outskirts or in the village, she often doesn't even talk about the mental health, and it's become very difficult for her to reach out to the doctors and to talk about it because of the geographical barriers. So many women, especially in rural area, yes, accessing mental health services is a luxury and they can't afford it. The cost of the treatment and transportation, taking time from their work and household responsibility, can be prohibitive. Additionally, the cultural beliefs and attitude towards mental health were highlighted as a significant barriers, with some women preferring to rely on traditional alternative healing practices instead of seeking professional help. So, what can be done for improvement? So, promoting mental health awareness is the major and broad term. Um, Exploring gender biases in psychological research and treatments, because research in this field is little limited. We need to explore more gender biases, and we need to address. We need to do research and the treatment towards it. Mental health services must consider these intersections to provide equitable care. That means intersectionality. Tailoring treatment to individual needs is essential. Gender specific therapy, um, for sexually assaulted survivors, acknowledge unique experiences, because trauma from individual is different and is unique. Every woman tells you a different and a unique story of her life. So it's very necessary to address to acknowledge unique experiences and counseling for that. Breaking stereotypes. Um, yes, resources and support for women mental health, to have a counseling, to talk about it, having helpline and crisis interventions. Community based support is very important, because in rural area, in low community, having no education about awareness about mental health, we need to have more community based support programs, educational resources, self care practices, and navigating stigma and the cultural barriers, because the kind of cultural barriers inside, um suppose Delhi area, is very different from the cultural support in somewhere in Bihar, somewhere in Rajasthan, because the community is different, beliefs is different, and their cultural practices is also different. At last, um, women's mental health, I would like to say it's okay if you have a bad day. It's okay if you make mistake and you are less perfect or ask for personal space. But prioritize, you need to remember and you need to learn how to prioritize yourself, taking break from everything. Self-care, self-love is only thing. And to talk about, if you are having any problem, ask small girls and adolescents in your family, that if they are having any problem, they are having any issue regarding adolescent, regarding body changes, hormonal changes, biological changes. That's the only way. These are my preferences, and thank you so much.